Good afternoon. It's Monday afternoon. I'm Joe Lamb and Michael Stone's with us, and we have our special guest, Dr. Lisa Moore. She has her doctorate in physical therapy, and she has a unique practice over in Tacoma, Washington. How is everybody today?
Fantastic.
Doing great.
Good.
It's great to see you.
Good weekends.
Dr. Moore.
It's good to see you as well, Dr. Stone.
So why don't you tell us about your practice a little bit, Lisa, because I found it fascinating when you and I were talking about it and how it specifically helps people in whom we don't really think about making behavioral change a lot of time.
Sure. I have a practice. It's called REACH, Cancer Rehab and Wellness, and that and wellness is a really important component of it to me. My kind of specialty niche is really helping people at any phase of cancer diagnosis, from just initial to aftercare, to recover their vitality, their strength, their mobility, after surgery or radiation, whatever their goals are. I really like to know people's story, their life, what's important and meaningful to them. We work multifaceted approach from mobility to yoga, massage. But I also like to incorporate mindfulness and meditation because stress is often a huge part of their experience, often including even before. And then also nutrition. Oftentimes people will ask me how to optimize their nutrition to improve how they feel, have healthy weight, and reduce inflammation. So we really try to touch tabs on all of those things, sleep hygiene, and all the levers that you can pull to feel the best we can on any given day, right?
Yeah, I mean, the thing that I think is really interesting about that is that a lot of us kind of assume that the pursuit of wellness or the pursuit of better function goes away when we're dealing with like a life-threatening illness. And it becomes kind of, I'm struggling, I'm fighting, I'm doing what my oncologist may want, or maybe if it's not a cancer diagnosis, I'm doing whatever my, infectious disease doctor wants, or my cardiologist wants, or my pulmonologist. And we forget that even in the setting of all of that, there is a huge place for kind of the fundamental lifestyle factors to be changed and to be modified and to improve the opportunities for wellness.
Yes, 100%. It's in the evolution of my practice for 25 years, nutrition was not a component of that at all early on. And as I struggled to help people deal with pain and joint aches and issues that were not easily solved with the typical physical therapy realm, I've found nutrition to be incredibly impactful. And with many of my clients that are dealing with medications that may make their joints sore and stiff, it's a tool that they have control over to really help improve their quality of life day to day and complete the treatment that they want to complete as well. Yeah.
Absolutely.
Yeah. And it is interesting, isn't it, that so often some of the same imbalances that lead to increased risk for chronic illness are there when suddenly somebody wakes up and they're given a diagnosis that way. And just by trying to create balance in those areas that encourage healing and restoration or increased resilience are even more important once they have an identified diagnosis.
Absolutely.
Yeah, for sure.
We all had the opportunity to meet during a a retreat that the Consilience Partnership, Dr. Stone and I, and Lyra Heller and Courtney Suter led out at Harmony Hill, which I think is an amazing resource that we have here on the Lower Peninsula.
Harmony Hill is phenomenal, a phenomenal resource and healing space. That was really one of the most unique weekend experience retreats I've had, both in the information that y'all shared, but the community of people there that are serving others, and the space that they've created to really have this heart-centered focus and connection with others was really transformative. It was a wonderful experience.
Did you have the opportunity to get to know Gretchen very well, Gretchen Schade?
Yes, I did get to speak with her for a little bit, and she's just an amazing, amazing woman. Yeah.
Gretchen is one of the very early advanced nurse practitioners in the state of Washington. And early on, she took it as her challenge not just to get prescriptive rights for nurse practitioners, but to start finding options for people to have a different experience around their cancer. And this just recently, they celebrated, I think it was the 35th year. And it was a wonderful celebration of the commitment Gretchen has made for half of her lifetime to take Harmony Hill from a place that was someone's home on a beautiful piece of land overlooking the Hood Canal in Union, Washington, to a center which, as they said, has like, I think, millions of dollars worth of buildings on it now, and provides thousands of people each year with retreats. And the cancer retreats, as opposed to the wellness retreats, and as opposed to the retreats for resilience for healthcare practitioners, the cancer retreats are all free for the attendees, which is quite remarkable.
Yeah, they've started back up. I think their first one is at the end of the month too. Yeah.
Yeah, they just gave their first one, I think. And apparently it went quite well. We had the kind of honor of doing a Consilience Partnership retreat there, a wellness retreat. Our focus kind of being that behavioral change isn't easy, and it's with all the kind of things that confront us in our daily life, if we don't know what's important, meaningful, and valuable to us, how do we decide that the change is worthy to do when we're confronted by other choices? And so, we focus a little bit upon understanding why we want to make changes by getting to know ourselves better, and then using the functional medicine model to provide a group of possible changes that make good sense from kind of a best practice perspective.
How do you, Lisa, how do you find in your care of the patient and incorporating in your reach programs, do you ever find that along those lines of purpose and meaning, that it becomes the patient becomes aware and more focused in the midst of their cancer journey?
Yes, I mean, to me, that part is imperative because they're often looking at patterns that has been part of their life for years, and often maybe even self-soothing behaviors and comfort behaviors. But we talk a lot about, where do you want to go from here? What is next? And if I present an opportunity for something new, we talk a lot about why. Why would you want to do this? Why is it going to be important for you? And what is your life going to look like if you make this change? What is it going to look like if you don't? To me, that motivation to see that motivation to achieve something different, or to have that purpose, which is often around family, it really helps them to be successful as they approach that change.
Yeah,
Maybe a little more range of motion, not just of joint and muscle, but range of motion and emotion and purpose.
Absolutely.
Years ago, I attended Jim Gordon's Center for Mind Body Medicine's cancer care conferences way back, probably 98, 99, and 2000 were the three that the center gave. And it really knocked my socks off at the first one to hear patients, because it was like one of the first conferences I went to where patients attended, caregivers attended, practitioners attended, a broad spectrum of practitioners, across the whole care model, and researchers and some policymakers. Everyone was together and talking about cancer. But to hear patients talk about the fact that the diagnosis in some ways had been a gift to them, because it allowed them to clarify what they wanted to do with the rest of their lives. I thought that was really fascinating.
Absolutely. When you mentioned that, I think the first introduction that I even got to this was Dr. Bernie Siegel back in like 1989, talking about the mind-body experience in working with cancer and healing, creating that kind of healing internal environment. That he was kind of a pioneer to me in that aspect.
Yeah. I got to meet him actually at that conference, at the first one, and got a copy of his book. And he did a lot of, he was very involved with popularizing the work, I guess it was of Symington, who had done some of the early group work, group support work in women with breast cancer, and showed what a difference it made. Another remarkable practitioner who was at that conference was Jeremy Geffen, who's written that book called A Journey Through Cancer. He's an MD from Florida. And what I really liked about his model was the concept that we didn't, and this fits in with your work, Lisa, that we don't have to turn someone's body into a battlefield. Instead, it's a garden which they need to tend and work on and grow. And with the right inputs, you get a better outcome.
Yes, absolutely.
It's I think there's an interesting challenge, and I haven't seen any questions pop up about this, but there's an interesting challenge when you're dealing with people with life-threatening illnesses. They think there's going to be some magic, perhaps, that there's going to be an answer for them. Do the two of you find that, Lisa and Michael, do you find that in your practices very often, that people are coming to you looking for the magic when you start talking about integrative medicine or lifestyle medicine or functional medicine?
I think people are often looking for the one thing, the one supplement or the one lever, but it's not one thing, right? There's so many of the pieces of the puzzle that work together to create that overall health in your system. So that is a barrier often is dealing. They're looking for just the one thing to do, but we talk about lots of different things.
Yeah.
Yeah,
Michael?
I think often if that one thing emerges, it's hope. And if that one thing emerges, it's empowerment. And if that one thing emerges, it's a refined focus on what's meaningful and important. And they may come in, people may come in hoping that it'll be this one supplement or this one chemotherapeutic. And I think, you know, the power of hope in helping our immune system, the power of movement in helping our immune system, the power of breaking and finding new paths for healing, and its influence on us really all ties into that hope component. Now, if you could put hope on in a pill and say take it twice a day, maybe that's incorporating a little bit of gratitude and changing of focus.
Yeah. I think that partly goes to what David Jones, who was the senior partner in your practice for years, Michael, and president at IFM for years, you know, that valued so highly, which was the patient-clinician relationship. Because if that relationship worked, then there was the opportunity to generate hope, generate vision, and generate relationship to support that. I remember at that first conference, I chose to sit out the afternoon sessions on like the second day, the breakout sessions, and there were 4 different breakout sessions taking place, and 3 of my patients were there. And I have to say that I sat out the afternoon sessions because I kind of thought that the topics were a little bit boring and the speakers left a little bit to be desired. But it had been a long conference, but I was sitting in a place where I could see the entrances to the 4 rooms. And I saw my patients and probably other patients bouncing in and out of rooms almost frantically. Like, yeah, the answer wasn't in that room. Am I missing it in the next room? And going back and forth, like coming out of a room and going, it wasn't as good as where I first was, and running back. And it really struck me that you're right, Michael. It has to be a change, and it's one of the big pieces of our job is to reflect a different model to people so that they can feel good about something, whereas they kind of expect it to be a battlefield and someone to come striding in with a weapon, a pharmaceutical weapon, and they were going to win the day. And they were going to be the general who controlled the battlefield of their body.
Yeah, interesting. How have you seen in your 25 years of practice? How have you seen the expectation change with patients? Have you seen more of a partnership that emerges out of your techniques and your algorithms? How have you seen it change for you?
Great question. Yeah, that evolution has been quite broad. You know, it was in the beginning as if I was issued a magic wand, right? Someone would come in and their low back pain, and you wave your magic ultrasound wand and make me feel better. And it has become much more of a partnership in really, I think the change, I'm just a facilitator of helping them find what works for them versus me telling them what to do. I think that it's my job to really help them have a level of understanding that really works, and to fit into what is important to them. So that partnership is huge. And to me, when I first meet someone, that's one of the most important things, is that we create this environment of trust, and that I, at least if I am the right person to work with them, that they can feel confident in the things that I'm sharing and doing. But that I'm just a facilitator for them to find the things that they need in their life.
So I have a question for you, Lisa. How do you think most people find you?
At this point, it's really word of mouth has happened. My website is up. I'm collaborating with some of the practitioners, oncologists and radiation oncologists. The Carol Milgard Breast Center, where a lot of the mammography is done here locally, has my information. But my website, reachcancerrehabandwellness.com, is the best place to kind of find me.
So that's www.reachcancerandwellness.com.
Cancer rehab and wellness.com.
Yes. Oh, cancerrehabandwellness.com. Okay.
Yeah, correct.
Cool. Because actually, we wanted to, we put out some Instagram posts earlier today, and I wasn't sure where to link those posts, but we'll go back and link those posts. So, Michael, what's your biggest challenge in taking care of people with the diagnosis of a cancer in your practice?
Helping them reframe it. Often the getting over the shock, trying to transition into hope, trying to transition into, instead of thinking of this as a death sentence, think of it as a chronic illness. And what are the things you can do to decrease chronic inflammation, improve chronic healing, improve chronic nutrition adequacy. And usually, depending on their timeline and experience in their family, that can be a gigantic barrier. So right out of the gate, I try to incorporate gratitude and actually give it as homework assignment. I'd like to see you, like to see you in a week. I'd like you to see the nutritionist actually see you in 2 weeks, have the nutritionist see you in a week. Recognize we're going to be doing things to support your treatment. And then I usually give them, then we start trying to empower them right out of the gate, utilizing McKee's book, After Cancer Care. Because if you incorporate any of those after cancer care techniques that relate to lifestyle, adequacy of nutrition, adequacy of rest, adequacy of movement, adequacy of all those things that we talk about, I just say, if you incorporate these now, you actually get through your cancer therapies better. And so it's empowerment, kind of entrainment of hope, and trying to extinguish the dread of the term while we're helping them manage and reframe fear.
Yeah.
Those are the big things.
Yeah, I think that the last one's really important. I find very few people know what prognosis actually means. They take it as their sentence. I've been given a prognosis. It's almost like I've been given my jail term, or I've been given the death penalty. And prognosis only tells us what's going to happen to a group who are like you. And I frequently point out to people that, if Bob was sitting over here next to me, and Bob had recently been diagnosed with pancreatic cancer and had a 6-month prognosis. And I'm sitting on the opposite side of the desk from Bob, and I'm in my 60s, so I have a 20-year prognosis. That prognosis doesn't actually tell us how either of us really do. It tells us how 100 of us would do. Like 100 of me on this side of the desk would typically live into their late 70s, early 80s. And 100 of him would probably be dead in 6 months. But he could be the one who survives for 20 years, and I could get run over by one of the tractor trailers out front delivering nutritional supplements each day as I leave to go home. So, prognosis is groups, not individuals. It's useful for getting a sense about what you want to get done, what's important to you to get done, and what the time frame may look like. But you're absolutely right. It's not the sentence, and it has to be removed so that people end up getting hope. Lisa, you raised your hand. I think you really comment about it.
Yeah, that it makes me think of the kind of Buddhist parable about the two arrows of suffering. And I think when you have a diagnosis like cancer and you're looking at the word prognosis and time, it puts us into a future state of thought, which takes us away from this present moment experience. And I was going to ask Dr. Stone if you think that hope can be cultivated, and if you can cultivate it using like mindfulness and tools for just becoming more aware of what's happening in the now and helping to just have a little bit better control of those thoughts that want to project into the future and into the past, and resisting and attracting things that we like and dislike.
Yeah, I absolutely do. And I think I often put it in the framework. I often use the example of a breath. When somebody takes a breath in and it's held, that 1 second is 1,000 milliseconds. That 2 seconds is 2,000 milliseconds. How many thoughts, how many changes in perspective can suddenly fit in to that distance between when you stop breathing in and when you begin to breathe out? And think of that as that is the time now for you to ponder and begin to reflect on the gratitude and the good and what do you hope to change. And some people consider that, the space between the notes can be an infinite amount of time if you're focusing on the small, beautiful improvements. And so, yes, I think it can be cultivated. And it usually starts for me when you can get somebody to not list their top 10 dreads, but their 10 things that they have gratitude for. And when that becomes a homework, or that becomes something you do right before you sleep or right when you wake up, then it does shift, doesn't it? It shifts our perspective from fear and dread to a little more of a place of peace. Right?
I like that, Michael. There's a quote by Frank Herbert from Dune. I think it directly addresses removing something that fills that space, which you were talking about, fear. And the quote is, "I must not fear. Fear is the mind killer. Fear is the little death that brings total obliteration. I will face my fear. I will permit it to pass over me and through me. And when it is gone, past, I will turn the inner eye to see its path. Where the fear is gone, there will be nothing. Only I will remain." And that's the space, I think, in which we can build hope. And, being a science fiction fan, I can't wait to see how Villeneuve handles the upcoming movie, but there's certainly some wisdom there in that prayer. It was the Ben Gesserit litany against fear, and hopefully I said that right. I'm not sure, but I think that really is something that we have to do. You know, instill hope by taking away what's in those gaps, the fear that most of us hang out with.
Yeah, and allowing them to express it, and for us to express it. You know,
Yeah,
especially when we're caring for somebody. I fear that we can't. I fear this. I fear that. Allowing them to express it, and then hold a space to move them through that. You know, and
Yeah.
it ties into purpose, Joe.
right.
It ties into what is best. You know, when you can identify that kernel of purpose, and we've seen it with so many patients, that kernel can take them through very dark times and can be the thing that is so important that they get to, right? So isn't it dynamic? Boy, Dr. Lisa Moore, you have chosen a powerful place to help people, and that is helping them gain, restore, or discover function. And it's wonderful to chat with you again.
Yeah.
Thank you. It's so good to see you both, and I feel just it's an honor to be able to serve in this way. I'm really, really grateful to do what I do.
Yeah, as Michael pointed out, there's a unique metaphor of movement in physical therapy related with movement in rebuilding function and moving a whole person to something new. I think that's really neat. Well, we've hit the 4:30 hour. Thank you all, everybody, for listening. Happy you could be with us. Thursday, 12 noon, it is the next Lunch and Learn. I neglected to see what the topic would be this week. I think we talked about genetics last week, so we may be, or last month. I'm not sure where we're going this time, but join me Thursday, 12 noon, right here. And I hope everybody has a good week. We wish you well. Bye-bye.
Bye-bye.
We'll see you now. Bye-bye.